God bless you. Hey, you are a hero. I'm so proud of you. God bless you. All right, you can sit down. All right, Mom. Hey, wait. We're applauding you. That's pretty special. Awesome. You can go sit with your mom if you like. Awesome. That's just incredible. So, need some tissues? She's just an amazing kid. So, this wild man, oh my goodness. He obviously stole the hearts of our therapists at the clinic. So again, I told you that we have ladies at our clinic that they can do it. I mean, they can get EEGs out of some of our most challenging cases. They can cause them to relax. They can get them to calm down. We can get good data, because that's really the basis of it. So he's got some girlfriends for sure, this Maddie boy. So I'm going to bring Lynn up here. Lynn, Emil, come on up. Tell us about your boy. You comfortable using this mic?
Sure.
All right.
Wow.
Rock on, girl.
I'm a little teary-eyed, and I'll try to just share with you our journey and our story, and without getting teary-eyed, because it's been one of the best, amazing years that we've had since our journey began when Maddie was diagnosed at 2 years old. Thankfully, 2 years ago, we were, by the grace of God, brought together with Dr. Bradstreet. And it's just been a life-changing situation for me and my family and my son. So I'm just going to smile and try not to cry, because it has been a long journey. As all of you mothers know, we fight every day and never give up hope. And we want our kids to achieve everything that they possibly can. And I'm happy to be able to share my story, because it's always been my hope that I could share a story. So today I'm able to do that, so I'm very excited.
For 1 second, tell us a little bit about what you do for a living.
I'm an occupational therapist, and I have a therapy business that we provide services to children with early intervention and preschool services. So I started the business prior to having my son, and never imagined in a million years that I would, obviously have a child with autism. And my life has changed dramatically, but it has moved us forward to bring as many, paving the way to help so many kids along the way. And that's what I always tell Maddie, that's what we'll do. So we started the MRT last summer. In July. I went down there for 5 weeks, and with the greatest hope and praying to God, please make this work, because I've tried everything. We've been doing biomedical for 2 years, since he's been 2 years old. So we did that, and I think the biggest, in which we have seen a lot of growth throughout the whole year, like things that not so much immediately, but over time that we have seen the progress. Simple things like Maddie's calmness, focus, self-regulation. His teachers are blown away this year, and is doing the best he's ever done in school. And where strangers are coming up to me, well, not really strangers, but the school community, and saying, "Wow, Maddie's doing awesome. What's going on?" And I'm like, "I know, it's great. This is what we're praying for." And he is just been tremendous. Simple things like, as moms, we all can relate. Gosh, we want them to engage and play with their siblings. He never did that. Andrew, he has an oldest son who's our oldest brother, who's his biggest advocate, wants him to play football and baseball, and I could never get Maddie to do that, And now he's playing football and throwing the baseball to Andrew, and we were able to go to a movie as a family for the first time and sit through the whole 2-hour movie, and Maddie's just hanging out, eating popcorn, quiet, watching the movie. Andrew, his oldest brother's looking over at me going, yeah, we're doing it, So these are all great things that we're all, we're seeing and experiencing. And, for us, we came back in April again, because Dr. B said, well, I think it would be great to come back and do a little bit more MRT and do the low-level laser therapy.
about it.
Okay. The LLT, the low-level laser therapy.
We'll talk about that some more tomorrow morning.
Yeah. And it's just been dramatic. And I think if you're looking, for a treatment and an intervention, as all us mothers are fighting and want our kids to achieve success, it's definitely, you can do the week trial to see if your child's a candidate. And if he is, expect great things, because we are seeing it and we're living it. And yes, we're making progress, and it's continual. And it's always been my hope that, in my goal, that I want Maddie to be able to decide his future, not it to be decided for him. And that's always been my goal and drive, to make sure that we get everything we can. And MRT has been life-changing for us. And I'm happy to be able to share my story and share Maddie's successes, because this is something I pray every day that I would be able to do that. And I just can't thank Dr. B enough, because he is in our core and doing so many great things for Maddie. And thank God that we did meet Dr. Bradstreet, and we are here today, and I'm able to share my story. So I think it's definitely something you need to do.
All right. Thank you very much.
Yes.
Thank you. So, do you guys want to ask some questions? You want to ask some questions of me or the moms or our sweetheart here? Ashley, come on. Lynn, why don't you come back up? So you can grab over on this side. There's a microphone for you. And I don't have a microphone for the audience, so if you don't mind standing up and being bold with your... So right here, go ahead.
I was just wondering what success you had with auditory processing disorder.
So the auditory center of the brain is the... I'll repeat the question, yes. So what kind of success have we had with auditory processing disorders? We don't treat auditory processing disorder per se that happens by itself. To my knowledge, I haven't treated that. We may have done that in California. I don't have any specific knowledge about that. But the temporal lobe is the auditory processing cortex. So area 22, superior temporal gyrus, is where things kind of get put together. That's an area that we see a lot of improvement, a lot of integration, and a lot of our kids have auditory types of issues. So that's not an unusual event for them. So it is something that we tend to improve. Do you have any experience with that? Did you notice any change in your ability to process language after MRT?
No, it's...
It's on. Got it? Do you have a mic on? Okay, go ahead. It works.
No, it didn't. No, I didn't really notice that. I was okay with speaking at first, but then it kind of helped. But I just had good language all along.
So auditory is what you hear. So Mom's going to jump up. She just can't help herself. All right, Mom, jump in there.
Ashley always had a hard time in a group conversation. She could never participate because by the time she had something to say, the conversation had already moved on. So she'd make a comment, and as people get older, they would stop, look at her, and then go on, keep talking. She's already out of the loop. So she always was able to converse with adults better than other peers, because adults ask questions or are more tolerant. But now, you were so excited this winter, a couple times you said, hey, I was actually able to contribute to the conversation. And you were never able to do that before, so you even noticed.
Yeah. That's great.
Okay, good. And what about with your boy?
Well, I want to share what he wrote. I know I spoke for Maddie myself. But when I asked him about our trip to Georgia, I asked him to share his experiences. And this is what he told me. And he's nonverbal, and he uses RPM as his means of communication. But this is what he wrote to make us understand. I feel great. I'm able to pay attention to a thing that I want to focus on much better than before. I did new activities in Georgia that helped me feel better. I don't have to try as hard to listen to people when they talk to me. I feel more at ease. I feel like I am able to act more like a man instead of a child, because I don't have to run and make so much noise.
Amen to that. That's awesome. Beautiful. Okay, where are we at on time? I think, are we good to 5:30? Is that our 5:30? Okay, so we have about 10 more minutes approximately? Yes, 10 more minutes. Okay, great. Okay, so yes, ma'am.
Have you seen where your QEEG changes, but you don't actually see any symptomatic change in the child?
So can we get a QEEG to do better and nothing else to change in terms of the actual phenotypic expression of that EEG, so how it looks? Absolutely early on. So we might see an EEG change significantly in the first few weeks and not see that effect for maybe 2 or 3 months later. But it's been very unusual to see a significant change in the EEG not relate to other things. They're more aware, they have more presence. I would say that the first thing that most parents report back is their child is just more with it. They're more present, they're involved, they can feel the connection with their kid. That almost always happens immediately. So, we're not in the business of improving EEGs. We're in the business of improving brain function. And it's hard to imagine that an EEG could be that much better and not see some sort of out-processing in some way. So if you feel like that's happened, then we need to look at some of the other things that may be obstructing that process. Yes, ma'am. Epilepsy is a great question. Thank you for bringing that up. So we've treated, at least I'm aware of, probably 25 cases of kids with epilepsy. Now, we can temporarily increase the risk of epilepsy in epileptic patients. I've not seen epilepsy occur in a non-epileptic patient, but we're stimulating the heck out of the brain. And in someone who has epilepsy, that is a little bit of a risk. In most cases, however, if we proceed on and we get that brain more synchronized, it's more efficient, entropy goes down, which is the heat and the efficiency of the brain improves, then the risk of epilepsy overall diminishes. And it's actually, we've seen some very good results with epilepsy. De novo epilepsy. So children with autism are at about an 82% risk of epilepsy throughout their lifetime. So they're a very high risk population to begin with. We could potentially elicit that. We could evoke that. We stay well below what's considered to be the safe margin by FDA standards. So our normal process of how we stimulate is not at an epileptic level of intensity. So, but could it happen? Sure. Yes.
You know how you said you could locate the embolic
Yes, we can in three-dimensional space. Yes.
Can you do that with narcolepsy as well?
I don't know.
No experience with that?
No, I haven't used this process for narcolepsy. So she keeps falling asleep during that? Yeah. So let me talk. Maybe we should speak to her husband about some of that. Anyway, over here. Yes, sir. Okay, how old is the oldest patient with autism I treated with MRT or just in general? Okay, the oldest patient that I can think of off the top of my head with MRT is probably around 33, 34. Very good. I mean, no, very significant improvement. Quality of life, self-help skills, managing their own finances, all those kinds of things improved dramatically. So, one more or two? Yep. Cost and funding. So I never have to pay for it. I think it's great. So cost. The 1-week trial is $1,000. You can pick up information on that. That includes 2 quantified EEGs and 4 treatments. A lot of people have insurance that covers most of or all of the cost of the EEG for the 1-week trial. And my opinion is everybody should get a 1-week trial. I mean, everybody should do that for the amount of money that it is. And I realize it's not throwaway money, but it isn't a huge amount of money. You get so much data, and we put so much work into the analysis of 2 EEGs, the way we process the physics. It's actually a loser for us. We don't make any money in that process because it's so intensive. That, I think you owe to yourself just to know about your kid and know how the brain is functioning and get a sense of what it's like. After that, depending on the number of treatments, I think it's $495 per treatment. We like to do another EEG every 10 treatments. That's about $650, I believe. And Gia tells me I'm saying that that's the truth because I don't really get involved in the money a whole lot, but that's about the cost of it. The technology is all owned by the Newport Brain Research Laboratory. I have nothing to do with setting the fees. I'm the doctor who facilitates the process, but it's all up to them. And that's where they've set things at this point in time. Just to let you know, Workman's Comp currently pays the BTC $1,000 per treatment.